me, it's hard to juggle all the things you have to do in one day. And coordinating a healthcare appointment can add to the stress. But the VA has something to help. Welcome to VA Video Connect. Thank you guys for joining us.
Thank you.
So, Stephen, tell us about VA Video Connect. What is this?
Yeah, so VA Video Connect is a secure way that veterans can meet with their providers over video from anywhere in the country using any device, laptop, cell phone, tablet, whatever.
So a veteran can sit at home and have an appointment with their doctor, VA doctor?
Yep, that's it. You've got it exactly.
So what kind of technology, Luis, would a veteran need to make this happen?
Any smart technology. They need an email address, and they also need a smart technology like a cell phone, laptop, desktop, computer.
Is it safe, private?
Yes, it comes with encryption, so it's very safe.
Yeah.
They even have features where you can lock the room once you're in it, in the virtual medical room.
Okay, in a virtual medical room, lock the room. And how did this come about? Why are we offering this service to our veterans?
We want to increase access to care to our patients, and so this is one way in how we increase access to care. So sometimes the patients can't come to the clinic for a visit, and so we want to give another option so they can still visit their provider and still continue treatment.
So how does it look on the patient's end? I'm trying to imagine this, sitting at home and talking to my doctor.
Well, if you've done FaceTime on like an iPhone, you've done VA Video Connect. I mean, it's very much the same thing. Yeah, just more secure.
And does this apply to every veteran? I'm thinking, usually you have some sort of physical ailment that brings you in to see the doctor. What would qualify for using the VA Video Connect?
Be a veteran.
And that's a good way to start at the healthcare system. But what about, would all physical conditions use this, or does it apply more to some people?
Well, it's great for things like mental health appointments.
Yeah.
It's also good for appointments where veterans don't need hands-on contact with their providers. But there are options too if a veteran does need more like a hands-on approach. We have cameras that they can be used at clinics that are far away so that they can get specialty care, and maybe you'd like to talk more about that.
Yeah, so some good examples of other clinics that use this technology would be surgery, audiology and speech.
I have to stop you with surgery. How does surgery use this technology?
Well, they can use it to consult their patients.
Okay.
I had one provider who was able to diagnose a skin condition using the technology. So there are many, many ways on how the technology can benefit the patient. On the other end, where we have the patient, we have what we call a CAS card or global media card. And that comes with peripherals, and so we have cameras that have high pixel rates, we have stethoscopes that can listen to hearts, and we also have otoscopes so we can look into ears, eyes, nose, and throat.
So I'm thinking this would be great for the patients who have those chronic conditions that require several visits to a medical center.
Absolutely.
And the time it takes to schedule the visit and get here, this would be really helpful. Have you seen it being used that way?
Oh yeah. Yeah, we've seen it in many different ways. Even weather, when weather is a factor, we've seen it help that way. And what other ways have you seen it, Steve?
Well, it's really good for our patients that live like on the Eastern Seashore and can't get in for a specialty appointment. They have to travel 2 to 3 hours to get here. So that's one way. In mental health, we've used it with veterans that are like traveling on business trips across the country. We've used it to bring family members into a session. Like for instance, maybe I'm meeting with a patient and they have dementia or experiencing memory problems, and so we bring their family members in from across the country or around the corner.
Well, that's a great way to use it. I just thought about my grandparents when you said that, to bring family members in.
It's a great tool to augment the care that you're providing for the patient.
So Stephen, how would a patient make this first appointment?
Okay. When they're talking with, like, say, a primary care doctor and the doctor wants to refer them to either a specialty clinic like mental health, for example, they can request video on demand and they can put that right in the consult. Or a patient that's already involved in care can just ask their provider. And we have a mandate where 100% of our providers need to be VOD or video on demand capable. So if they ask, it's a service that can be provided to them.
Okay, and can they call? We have an appointment line where you can call and schedule an appointment. Can you schedule a VA Video Connect appointment through that line as well?
Right now, the best way to make that connection is through your provider.
Gotcha. Okay,
Yeah.
great.
Once you establish care with the provider, then you can look at different options on scheduling an appointment.
And your provider would know what's best for you and what they, yeah.
That's a really great point. And so we want this tool to be used to augment the care of the patient and not take over that warm touch.
Stephen, walk us through this from the veteran's perspective and the clinician's perspective. What does it look like to get this set up and go through the process?
Yeah, I'm so glad that you asked about that, because there's a perception that this is a technology for younger veterans, and it's really not. If you can open an email and click on a hyperlink, you can participate in this program. So your physician will send you out a secure email, and there will be a blue hyperlink in there, and you just click on that link. It'll take you to a virtual private medical room. Your system will ask you, can we use your microphone and speakers? You have to answer yes to that, but that's the only question. And then you can meet with your provider just like you're doing FaceTime.
Great, great. And then tell us about more of the benefits of VA Video Connect.
The benefits is anywhere to anywhere technology. You have a secure connection. The connection is only good for 12 hours, and so there is an expiration whenever the invite is sent to you. But the main thing is anywhere to anywhere technology.
And I know the VA Maryland healthcare system got a recent distinction to help other veterans in our region. Stephen, can you tell us more about that?
Sure, we work with the Office of Rural Health, and we also work with the VISN to develop what's
The VISN, that's our network.
Yeah, our regional office that is in charge of the whole Capital Healthcare Network, and they helped us with funding to build a telemental health hub here. So we provide services to other hospitals within our region, and eventually we'll provide services throughout the nation.
Great, that's perfect to help the other veterans within our region. Using this technology, why not branch out?
Yeah.
It's a way that we can recruit medical professionals in hard to recruit areas. It's a way that we can support other medical centers who may have a backlog of patients and just not have the staff to support.
It's great to see the VA using this technology to broaden its access to patients. And one important question: how much does it cost? Does it cost extra to have the video appointment? No. Okay. Same copay applies if that applies to the veteran?
Yes.
Okay.
That's actually the great point about it. 179 stop code. So the copay for the VA Video Connect visits don't have any copay at all.
Okay, good, yeah. Yeah, so I'm loving this. Thank you both so much for joining us.
Thank you.
Thank you.
I joined the Army in August of 2001. The transition from military to civilian life was rough. I was registered with PTSD when I separated. My wife actually told me later that she was scared to be around me.
I'm Natasha. I was in the Army. Our chief decided to take a turn that we shouldn't have taken, and we hit a landmine, and it exploded beneath my seat.
Well, in Iraq, I was working in and out of Iraqi police stations. I saw more actual combat in Afghanistan than I did in Iraq.
And it was very difficult to come back, and to feel like you lose that sense of community.
I decided to get some help. So I went to the only resources I knew, and that was the VA. And that definitely saved my life and my marriage.
I always encourage people to go to the VA. I always encourage people to try it. Like, if they're telling you, listen, we're gonna make sure that you have what you need so that you could succeed in life, why not take advantage of it?
Our society needs this generation of veterans to pursue their education and to continue to help make this a richer and a stronger world. It is an opportunity. It is something that these veterans have earned by their service.
It's really easy. People think it's hard to use the GI Bill in school, and it's not. It's a seamless, easy program, and the benefits are just unbelievable. While everyone else is working and scraping through college, you don't have to. You can concentrate on your studies and that transition into becoming a civilian again.
Obtaining the benefit wasn't very difficult. Once I contacted the VA, I was able to put in the paperwork, get it all started.
The GI Bill, there's several different programs that they can be utilized for. It can be utilized for a technical school, it can be utilized for an art school. If if a veteran decides that he's not going to go to school, or he uses some kind of different program, that GI Bill can be passed on, and his children will receive the exact same benefits that he would have received.
But it does cover tuition, You get $1,000 annually to use for books and supplies, and you get housing.
I've always had the love for education. I didn't have the opportunity. The military gave me the opportunity. The VA helped me accomplish that. And now I want to give back.
I'll graduate college in May of this year from the University of North Texas. You know, it's going to be an example for my sons that no matter what your limitations are, that you don't put limitations on yourself.
I'm now a functioning member of society. I'm about to be a doctor.
Just because you had a brain injury, or just because you have PTSD, or just because you have an obstacle, that doesn't mean you can't accomplish a goal.
The post 9/11 GI Bill was, the only way I can say it is a blessing.
Due to my injuries, I couldn't have done it. Without this benefit, it would have been a no-go.
I can wholeheartedly say that the VA changed everything for me.
Welcome to Veterans Health Watch. I'm Kenya Griffin. Let's be honest, most of us like to be in control of our own lives, and life is full of decisions. But what happens if you're unconscious or physically incapable of making those decisions? Will your wishes be followed? Will your family know what to do? We have helped to relieve that burden from you and your loved ones. Joining me is Dr. Preeti John from the VA Maryland Healthcare System. Dr. John, thank you so much for joining us.
It's a pleasure to be here. Thank you.
I'm sure you've treated patients who've been in this position before, and what can they do to help themselves?
I think it's very important to have conversations both with your loved ones as well as with your physicians about what's important to you. What do we mean by that? In healthcare, we engage in life-sustaining treatments on a daily basis. And by that, I mean everything from IV fluids to blood transfusions to dialysis to cardiopulmonary resuscitation and even transfer to an ICU when you're very sick. Those are all life-sustaining treatments that we make decisions about every day. And it's important for us to know what you would want in certain situations, especially when you're not able to make those decisions or speak for yourself.
So you're saying plan in advance. Yes. All these things could happen if you're sick or to sustain your life. But we want you to know in advance, how do you want to proceed if you're faced with that situation? Right.
Every patient is different. Every patient has different healthcare problems. And when it comes to the crunch, we require to make decisions about various things. And the decisions that are made are not always the same based on what goals the patients have. So for example, would a veteran want to be kept alive at all costs? Or does quality of life really matter to the veteran? Does communicating with the veteran's loved ones matter? Does functioning on your own matter? There are some patients who that matters to a great deal, and we need to figure out how we can best balance quality of life with the duration of life.
And then I know sometimes the family, when you're in the heat of that moment, your emotions can take over. So tell us about this plan you have to help veterans establish actually a plan to know what to do in that moment.
Okay, yes. A lot of times when veterans get very sick, their family and loved ones get very stressed out, and that is really not the best time to have these conversations. If we know in advance what your priorities are, what your goals are, how aggressive you want to be in certain situations, that would help us a lot. What helps us greatly is if we know who your healthcare surrogate is. So if the veteran knows who he or she would want to speak on his or her behalf, that is very helpful to document. And this initiative helps us not only have these important conversations before it's too late, it encourages us to document them in the electronic health record, where it's accessible to all providers.
So how does a veteran start this process?
The veteran can ask about this initiative. It's got a very long name called the Life Sustaining Treatment Decisions Initiative, but if you just remember life-sustaining treatments, we make decisions about life-sustaining treatments on a daily basis when you're in the hospital, sometimes when you go to clinic. And this is what this initiative is about. What are your goals and priorities about your health care? And we've also made a pamphlet that explains it in very simple terms. And we are going to start giving this pamphlet out to VA Maryland healthcare patients so that things are explained, so that patients know that they can bring this up with their providers at any time, whether you're in the clinic, whether you're in the inpatient setting. You can say, can I have my wishes documented? And can I have a copy of the conversation?
Can I have my wishes documented, and can I have a copy of the conversation?
Right.
So if that moment ever happens, if you've completed this plan, your wishes are documented, and you have a copy, you and your family member in that moment, then what happens? How do the clinicians know what the person's wishes are?
Right. The documentation goes to a consistent location in CPRS. CPRS is the computerized patient record system that we have in the Veterans Health Affairs. All healthcare facilities have CPRS as the electronic health record system. And what we do is document this, and it goes to the top right corner of the computer screen where it's accessible in the same location by any provider, whether you're in the emergency room or in the clinic or in the hospital. And that's the nice thing about this. The Veterans Health Administration is the largest healthcare system to implement this kind of initiative where it's easy to access the veterans' wishes if they're documented using this standard note.
Can you tell us the difference between this and an advance directive? It kind of sounds similar.
Sure. Advance directives are legal documents that serve as general guidelines. They're signed by the patient, and they don't have orders about life-sustaining treatments. So they're very general guidelines, and patients have the option to check a box that says, I don't know, it would depend on the circumstances. So this is more specific, and this is something that's signed by physicians after getting the patient or surrogate's consent.
That is a very clear distinction. Thank you for telling us that. So this is a great program where people can plan in advance, have their wishes documented, their family is relieved of some of that stress, they're relieved of some of that stress.
Exactly. It relieves the family of the added burden of making these difficult decisions when things get stressful.
Well, thank you so much for what you're doing with our veterans, and thank you for joining us. The VA has joined the nation. Our facilities are smoke-free. This move furthers our commitment to provide a safe and healthy environment for our patients, our visitors, volunteers, and employees. If you need help kicking the habit, talk to your primary care team or visit smokefree.gov. Help us clear the air.
I didn't care anymore. I basically lost hope.
Between 1976 and now, I've either been homeless or in county jails.
I was sleeping in a tent on 17th and Vine.
You don't just wake up one day and be homeless. You know, it's a progression, just like alcoholism.
Because I was too afraid to go in to the shelters anymore because they had started having bed bugs and just overcrowdedness.
To end homelessness, you really have to begin with housing. And that housing really is the thing that the veteran will tell you they want and need most to end their homelessness. For a significant number of the homeless veterans, the traditional approaches weren't really working. While the old models did temporarily help people get off the streets, when they relapsed, they were going back out and they were reutilizing emergency rooms. They were reutilizing inpatient hospitalizations, or they were ending up incarcerated into the county jails. So the big difference between Housing First and some of our earlier models is that there are no prerequisites, that somebody can move directly from streets into permanent housing. You don't have to be in a treatment program. You don't have to be clean and sober. You don't have to be symptom-free. What you have to do is agree that you want to work with us to end your homelessness. It really all begins with the outreach, which is really being out there on the streets, working with the community groups, trying to identify who are these men and women that are on the streets. How do we know them by name? How do we know them by what are their needs? And then how do we sort of match what's the right level of housing support and case management to end their homelessness and help them fully reintegrate back into the community?
And there has to be a passion for working with people, working with the homeless population, an understanding of, just the clinical issues going on, reasons behind people becoming homeless.
It really focused on that chronic homeless individual, the one that had been on the streets the longest, the one that had severe psychiatric illnesses like schizophrenia, bipolar disorder, or PTSD that just wasn't really able to be stabilized.
Hi, Frank.
I have to get notes. I have to get all my update my medical notes from the military. I got everything from Coatesville.
This program focuses again on the veteran first. So this way they can target some of the most chronically homeless veterans. I mean, one example that they've worked with recently is a veteran who was on the streets for 20 years. And none of the shelter programs really worked for him, or he wasn't interested in them. But by being able to go into his own apartment, he's now able to get some stability in his life.
The important thing in this is to match the service intensity and variety of services with the complexity of the clinical needs of the people you're trying to serve. In most of these programs that we're talking about, there's a highly complex individual with many needs, and so you need a multidisciplinary team to address those needs, and that's how they fit together.
You identify the veteran, you recognize that they meet the criteria for the program, you then move them into housing, and then you put the supports around them. That's a major difference between the Housing First model and the previous models.
We put the veteran into housing first, and then the clinical support teams are there to help them with any one of those other problems, be it employment, family reconnection, psychiatric symptoms, or addiction, in the sequence in which the veteran chooses, and also in the way, the pace, the manner in which is most comfortable to the veteran.
In Housing First, this is their home. They sign a lease, they move in.
Here I know I have to feed myself, I have to clothe myself, I have to take care of my bills, and if I can do that, unassisted, so therefore that measure of responsibility keeps me more so grounded than just saying, not having anything to take care of.
And we in the VA, or with our community partners, provide the case management and the supports that are needed to help keep them in the home.
Today, here I am with an apartment that is one of the biggest stress relievers that there is, knowing that I can go home tonight, unlock my door, and everything is the way I left it.
It takes a lot of building a rapport with someone for them to be able to trust you.
You build the rapport, the trust that trust that you have to have with people that that you're kind of putting your life in their hands.
Within Housing First, the approach was using a team-based model that really uses intensive case managers that have different backgrounds. They're nurses, they're social workers, they can be psychologists, employment specialists, housing specialists, all kind of coming together, sharing a caseload to help support that veteran.
Gregory Barnes.
Okay, I have that Mr. Barnes was actually seen last Thursday by Rico.
I mean, we try and work collaboratively with other shelters in the area, and again, they just help us identify who's a veteran, and then that way, if they're VA eligible, myself or one of my coworkers from the VA will get involved, and whether they're VA eligible or not, we'll have a peer specialist work with them.
You have better outcomes, and not just better outcomes from a housing perspective, with 85% of many of these individuals still in housing a year or 2 years after the initial engagement. It was also more cost effective.
These guys have been nothing but help.
It's really important to note that, it doesn't happen that first time. It really does take many, many encounters with that veteran to build that relationship, to reestablish some trust.
Being able to go back and be rejected at first maybe, or have them not want to, turn you away, and being able to go back and just try to little by little build a relationship with someone.
And then to start talking about, how do we help you truly be home?
In the military, that, you're taught to be self-sufficient. You're taught to be, take care of yourself, that you don't need help. And, and even though the help's there, you don't ask for it. Even when it's offered, you don't take it until you get to a point of desperation. And I got to a point of desperation in my life that one way or another I was going to die by staying homeless and an alcoholic.
And there were a couple veterans that, you just saw them go from, death's door to thriving in the community. When somebody finally gets their keys and moves in, and you're helping them move in, there's nothing like that.
I want to be here, and I know that in order to sustain this, I have to do the necessary things to take care of it. Or else, I know my other alternative, and I'm not prepared to accept that anymore.
Today, I have the choice to do right or wrong that will affect, my housing status.
I drop to my knees and say my prayers and thank the Lord, because that's my biggest support besides my family and friends. And I just thank you for having them in my life, having the VA in my life.
I consider myself blessed.
Because ultimately our job is to put ourselves out of business. We want to try to help these men and women be as successful and as independent as they possibly can be.
I really think we can help. We can end homelessness.
The veterans would always tell you they needed housing to end their homelessness.
We'll do this together.
This wraps up this edition of Veterans Health Watch. If you are a veteran, apply for VA healthcare today. You deserve it. Just visit our webpage for more information. You can find more episodes of Veterans Health Watch on our YouTube channel. Just type in VA Maryland Healthcare System in the search bar. And be sure to hit the subscribe button to get notifications of new videos. Don't worry, it's free. We'll see you on the next Veterans Health Watch.